Well, universal health coverage is expected to top the agenda of the Africa Health Indaba in Gauteng next month. The conference seeks to position Africa as a leader in medical innovation across the globe. But Africa Health's Bandile Hadebe says the NHI is not the answer to South Africa's health crisis. And he joins us now to discuss this even further. Dr. Bandile Hadebe, thank you so much for your time and a very warm good morning to you. Why do you think that the NHI will not fix South Africa's public healthcare system?
So good morning and good morning to your viewers. No. So we've never said that. We think it's the answer to fixing the public healthcare system. What is the problem is how the conversation is currently conducted. There's a lot of not listening to each other across the aisle and positioning the whole conversation as a political tool from both across the aisle. And because of that distortion and that dishonesty in the conversation, we are not really striking the correct chord. But in as far as the WHO is concerned and its expectation for all member countries to deliver universal health coverage, our only real tool is the NHI as an overarching view. But is the letter and spirit and the content and the contradictions within the policy the ideal situation? Maybe not. The other problem is that as a country, we tend to have a lot of high-level conversations and not really dig deep into the details that affects the policies that we're trying to drive. And that's the problem. But certainly, I think I'm being misquoted when they say I'm saying NHI is not the answer. I think NHI is the answer. The question is what form, what version of the NHI?
Well, the concept of the NHI is to make healthcare, quality healthcare, at least ideally accessible to all. Do you think this would be possible through the NHI in the country?
Certainly. And I think I really need to emphasize this point. We need to distinguish between the overarching principle and the overarching concept versus the articulation within the policy, the content of the policy. The overarching principle of NHI is a beautiful idea that really seeks to drive access to healthcare, to improve quality, and to reduce cost. That's built into the overarching principle. Have we articulated that correctly within the bill? Some may argue that we haven't. And I think if we are not listening to each other, then we're not able to actually correct those distortions. But certainly, the status quo is unattainable. We cannot maintain how our healthcare is structured. We cannot maintain how there's a distortion in the distribution of available resources, with the bulk of it servicing the private sector, which has a limited number of citizens sourcing healthcare that side, while the limited minority of resources are servicing 80% of the population. So that's not sustainable. With the best minds in the room, with the best intentions in the room, the status quo is unsustainable. We do need to drive a different version of how we finance healthcare, how we prioritize and optimize our limited resources, and how we drive comprehensive access of all available resources to all those who need it within society. And so NHI is really the answer. The question is the current form and the current position within the paper the correct route that should be taken? And how are we having that conversation to arrive at a functional, workable NHI? And that's the type of conversation we want to drive at Africa Health Indaba.
Speaking of conversations, what are consultations and engagements currently looking like between yourselves as medical experts as well as the Department of Health regarding the NHI? Are you hearing each other? Are you finding alignment? Is there still clarity that has been sought, as you mentioned, regarding how, as a concept, the NHI is a great one. However, when it comes to the contents of the bill, there seems to be clarity that's still sought there.
So I think there's been conversations that have been going on for a very long time now, and the department and parliament has had several consultations across the country for a very long period of time. And there's been position papers that have been submitted by NGOs, by private sector, that are geared towards reshaping and really improving the entire concept. I'm worried about whether we really are listening to each other I'm worried about a level of honesty on both sides. For instance, the private sector, the medical scheme section of the private sector, is not honest about market failures it creates. If you consider the fact that 15% of medical spend in the private medical scheme only go into administration. So that's 15% that could actually be going into healthcare, the actual healthcare services, but it goes into administration. We're not having an honest conversation around that. I mean, we had the health markets inquiry that was released a couple of years ago, collecting dust, and we haven't really revisited the key recommendations it was making on how to make our healthcare system work. And we really are talking past each other. There's sound conversations that are coming from government. There's equally sound conversations that are coming from the private sector. I mean, questions around the single exit price and how do you actually structure that. There's sound conversations across the aisle, but there seems to be this just difficulty in finding each other to say, we accept the concept of NHI, but can we then fix this clause? Can we fix this contradiction? Can we fix this? I don't think that's happening.
And just my last question to you, and I suppose very briefly, if you can, Doc, the Africa Health Indaba, I understand it's more than just a platform for innovation and dialogue. What are your desired key outcomes? Because this is a platform also to position South Africa as a leader in, medical healthcare. So with the NHI as a conversation also on the sidelines, what are the key outcomes that you desire for the Indaba?
So look, for Africa Health as a whole is a really a multiple faceted congress, which one deals with the business and trade of healthcare. We've got 700 odd exhibitors with amazing products across the entire value chain, looking for trade partners in Africa. And that's one of the key points that we want to drive. We want to position Africa as a significant player in the global health economy, which we currently are really lagging behind others. And not really benefiting from having this huge pool of a population of 1.2 billion people that could really be driving that market. So there's that business angle. There's an academic angle as well. We've got 15 CPD tracks across multiple disciplines: radiology, obstetrics, psychiatry, public health. And then we've got this engagement platform, which is really about driving policy-related issues, driving collaboration-related issues. And one of the issues that we really are putting on the core of Africa Health Indaba is this issue around regional collaboration, is this issue around patient mobility, where we've seen a lot of patients across the continent coming into South Africa seeking services, with South Africa actually sitting with a limited, funding PT for its own population, and so there's overburden on South Africa. How do you deal with that? We, from a humanitarian perspective, we can't close our borders. People come in looking for healthcare, and we're going to have to give them that space. But who's financing their visit here? Are there conversations that are happening at a SADC level? Are there conversations with embassies in as far as having to finance and fund their own citizens who are seeking healthcare in South Africa? So those are the kind of stuff that we're trying to drive. But really, it's a very broad, conversation. We've got 14 pavilions from different countries where they are bringing their products into South Africa to exhibit to the delegates at that conference.
Well, thank you so much for speaking to us. Unfortunately, we've run out of time, but thank you for giving us, of course, that synopsis of what is expected and the desired key outcomes from the Africa Health Indaba. Also, just speaking to me about your perspective regarding the NHI, Dr. Bandile Hadebe from the Africa Health Indaba, of course, talking to me there about the platform, as also his perception and perspective on the NHI in the country.